Another interesting case, a female in her 80s, been taking amlodipine due to high blood pressure, um, which she's been taking it for the past couple of months, and over the past few weeks she's noticed that she's got bilateral low limb edema, so both ankles are swollen. I'll try and use both terms, medical terms, and of course so people can understand what I'm talking about. So ankle edema, so her ankles are swollen. They are swollen during the day. As the day go along, they get worse. As she lay down at night, in the morning they're better. So and all her examinations other than that were normal. Her lungs were clear, saturating well, so there's no evidence of any kind of pleural effusion or anything, or any water in the lungs. So there's no need to go ahead and jump and change things. Of course, she's been taking amlodipine because her blood pressure was on the high side, and even today her blood pressure was 150 over 90 something, so which is a little bit on the high side, but I can understand she was in a GP practice. So what do I do with it? And I've again discussed it later on with my GP colleague, and they're perfectly happy with that idea and why we did it. So she's on amlodipine, which is necessary because she needs her blood pressure under control. We know amlodipine can cause ankle edema, and yes, she's got that, and that's a side effect of amlodipine. What we're going to do about it, we need to know she's not had a blood test for a while. We don't know her kidney function. We are going to check her bloods, we are going to check her USANEs, LFTs, etc., but mostly really her kidney function, and then take it from there and see if we can tweak her medication. I've discussed it with my colleague, and they said that there is a alternative to amlodipine in the same set of drugs. I mean, I will discuss later on how we do use hypertension, how we manage hypertension rather, and what drugs we give to who. There are guidelines, and we can talk about that later. But in this case, I didn't have to stop her amlodipine. I've advised her to continue taking her amlodipine. We've requested a blood test, which will be done this week. As soon as we get our bloods back and if our kidney function is normal, we can probably explore other drugs that we can try, and we can think about either stopping amlodipine or trying a different drugs which is in the similar category as amlodipine. So ciao for now.